This is a lit review of long COVID in children, where it's important to highlight that long COVID can include new symptoms or an exacerbation of underlying conditions. Children can develop POTS, MECFS, new autoimmune conditions, or even MISC, which is multisystem inflammatory syndrome in children. And not only is this a literature review, but it also is a prospective analysis, where the authors are looking through electronic health records, longitudinal observational studies, as well as clinical manifestations and other outcomes. And right from the onset, it's important to recognize that COVID disproportionately affects Black, Indigenous, and people of color communities, in addition to families living in rural communities and or communities facing economic hardships, meaning that COVID is exacerbating systemic underlying issues that already exist. The authors estimate that about 20% of COVID cases in the United States are in children, and they're using the 10 to 20% estimate of long COVID prevalence from a COVID infection. And since I haven't seen any evidence that long COVID occurs more or less frequently in kids than it does in adults, it's probably a safe assumption to assume that the same exact thing happens in kids, that with each subsequent infection, that long COVID risk goes up. So this should be taken as a conservative estimate because this is considering like 1 to 2 infections. And with that, the authors are predicting that about 5.8 million children in the United States have long COVID. But I would operate under the assumption that kids are getting infected with COVID much more frequently than adults are because of the lowered precautions, the forcing them back to school, kids just being generally dirty and not having general good hygiene practices. I would assume that the average child that has been infected with COVID has been infected more times than the average adult. In this paper, they're using the World Health Organization definition for long COVID, meaning the continuation or development of new symptoms 3 months after the initial infection, with symptoms lasting for at least 2 months with no other explanation. And another quick definition, so PASC is post-acute sequelae of COVID, which is another way to say long COVID, where it's important to note that long COVID can occur from asymptomatic infection in kids, where one study puts the incidence of long COVID development after asymptomatic infection at about 15% versus symptomatic infection at about 45%. Where examples of some of the long COVID symptoms include persistent cough, persistent shortness of breath, persistent headaches, persistent fatigue, persistent chronic pain, and persistent loss in taste of smell, or the re-exacerbation of underlying conditions such as persistent cough in kids with asthma, diabetic ketoacidosis in children with diabetes, exacerbation of mental health and neurodevelopment conditions, among other disease flares. However, you can also have completely new conditions that occur with long COVID, such as the development of type 1 diabetes and MISC or MIS-C, which is a hyperinflammatory response to COVID after the infection. So there's essentially 4 different groupings that can occur with long COVID. You can have the exacerbation of underlying conditions like asthma, persistent symptoms of the acute infection, completely new conditions that develop, or MISC. And it has a very nice graphic breakdown of all of the different things that can occur with long COVID in kids. For neurologic manifestations, it can be like headaches, vertigo, dizziness, tremulousness, things like POTS or dysautonomia. For mental health, brain fog and cognitive difficulties, low mood, memory problems. For constitutional symptoms, fatigue, sleep disturbances, generalized pain, MECFS. For respiratory symptoms, this can be like shortness of breath, chest tightness, cough, or even exercise intolerance. Then there's otolaryngology, just the throat and nose, which is nasal congestion, loss of smell or taste, vocal cord dysfunction. We have GI symptoms like nausea, vomiting, abdominal pain, weight loss, loss of appetite. For cardiovascular, we have things like palpitations, tachycardia, dizziness, chest pain, exercise intolerance, POTS, myocarditis, and arrhythmias. It could show up as irregular periods in young girls, in hematological conditions or blood conditions like thrombocytopenia, hypercoagulability, thromboembolisms, or mast cell activation syndrome. There could be musculoskeletal symptoms like weakness, arthritis, myositis, and dermatologic symptoms like hair loss, rashes, and things like COVID digits, which is getting blue fingers. Moving on, it's really important to note that we still don't know the long term impacts of having a mother infected with COVID prior to the birth of their child, in addition to the cognitive, behavioral, motor, and academic functioning of the children in the long term once they get repeated COVID infections and get long COVID. So it's essential to get those learnings in addition to learning how these COVID symptoms will reemerge over time for long COVID, especially during times of physiologic or psychologic stress, or even during reinfection when you have long COVID and then get reinfected with COVID. learning what the impact of getting additional COVID infection on top of your long COVID status will be. And then ultimately, how do you prevent these chronic conditions in the kids from developing into chronic health conditions in adulthood as they get older?